Hello, good people from wherever you're watching us from. Thank you for coming to MA TV. My name is Henry. If you have never subscribed to my channel, this should be the time to hit that subscribe button, like, comment, and share your opinions with us. Today, I'm here to share with you a very important matter, a matter of public health concern, a matter that affects us all, and that's about anthrax. Now, I understand that by now, you must have heard of some cases of anthrax in some parts of our country, and today we are here to share a little bit more about anthrax so that we know how do we prevent it, what are the signs and symptoms, if it happens, what do we do, where do we seek help, and we shall start right away. So, what is anthrax? Now, anthrax is a serious infectious disease caused by bacteria called Bacillus anthracis. That name might make you bite your tongue, so don't try to repeat it. Just know it's caused by bacteria called Bacillus anthracis, and this bacteria is found naturally within the soil. So it stays in the soil, sometimes in plants on the vegetation. This bacteria can affect animals, both wild and domestic animals, but the most commonly affected domestic animals are the cows. That's the cattle, sheep, and horses. Luckily, we don't have very many horses here in Uganda, and sudden death can actually happen from anthrax even without prior signs and symptoms. So this shows us that it's quite a serious disease that should be dealt with all the energy and effort. Now, whereas this disease of anthrax mainly affects animals, it can also affect humans, okay? And animals get infected when they ingest food that is contaminated with spores. Now, spores are inactive forms of the bacteria, so the bacteria can actually exist in active form for years, and it stays mainly in the soil, the plants, and water. So animals get affected the moment they ingest food that is containing these spores. Now, the moment spores enter into the body, they can spread through blood and they can reach all the different body parts, and that's where they cause the damage. So now one of the questions that have been coming up is which people are mostly at risk of developing anthrax. Now, people who handle animals mostly are at risk. Who are these people? The ones that deal with animals directly, like those who slaughter the animals, the herdsmen, the veterinary doctors, are those who produce livestock, the traders, the consumers, so the people who eat the meat, okay, the travelers, and the people who are in the industry that is concerned with producing animal products. They are mostly at risk because at any time they can easily get in touch with the spores, as I told you earlier on, the inactive forms of the bacteria. So the moment they get into contact with these spores, they can easily get infected and they develop disease called anthrax. Just like we have seen that animals are mostly affected, but we humans, we can also be affected, and most of the times we get this disease from the animals. It's quite important for us to know the signs and symptoms of anthrax in animals. So if an animal is affected with anthrax, it will lose appetite, it will appear disinterested, it can develop difficulty in breathing, sometimes they can have a high fever, sometimes also they ooze blood, especially from all openings, and this can definitely result into death. And as I mentioned earlier on, that death sometimes can happen even without prior symptoms. So if you're a farmer and you know you have your animals, at any time if you see any of these symptoms, you should really be interested and find out what could be happening. You can always consult a vet, you have a review, your animals are reviewed, so that they be sure that they are not suffering from anthrax, because from your animals, it's coming to you. We get infected with anthrax. Now, we get infected with anthrax the moment our bodies get into touch with the spores. And basically, this can happen if we get into contact with the contaminated animals or contaminated animal products, especially the meat. Or sometimes you can actually breathe in the spores. Because they're very small and minute, they can easily be breathed in and they can cause disease. Sometimes we eat food or drink water that is already contaminated with spores, and that way we can easily get the disease. Sometimes the spores can penetrate through our cut skins. Okay, cut skins, if you have any injuries on the body, the spores can pass through there and they gain entry into the body and they cause disease. Or if we participate in butchering animals that have died of anthrax, okay, this puts us at a great risk of developing anthrax. That's why if an animal dies of anthrax, don't bother to butcher it, don't bother to get meat out of it. Just know it's a gone case. Just get ways of disposing it off in a way that is safe and that is recommended by the Ministry of Health. Now, someone might ask, what happens when the spores get into the body? And that's quite simple. So, the moment the spores get into the body, they multiply very fast because in the body they're going to find food, okay? They're going to find so many of the conditions that they need to survive. So, they multiply very fast. And as they multiply, they produce toxins, okay? These are like poisons. And these poisons are the ones which mainly cause the illness that causes humans to be very unwell and sometimes can lead to death. So if it's not treated, you can easily die because of the toxins that have been produced by this bacteria by being inside of your body. Also, it's important to note that the incubation period of this bacteria, Bacillus anthracis, is 1 day to about 2 months. So somebody within that period of time, the bacteria can produce enough there can be enough production of bacteria that can actually cause disease that can also result into death, especially due to the toxins that are produced. So, the moment this bacteria is in our bodies, it definitely causes harm. And because of that harm, there's some manifestations, there's some signs and symptoms that will come. One of the most evident is it forms a clump of small blisters, okay? It forms some small lumps that sometimes itch, they usually swell, and eventually they develop an ulcer, okay? They form a wound, and most of the times, this wound has a black center, okay? And sometimes it's painless, and it can be located in the face, the neck, and the hands. Many times, patients also get fevers, they get chills, they tend to, shiver. They can get nausea and vomiting. They also lose appetite sometimes. They can get abdominal pain. And most of the times, the biggest exposure, the biggest risk that can get a person into developing this anthrax is if they have been exposed to animals or butchering animals that have died of anthrax. That's the biggest exposure. And the moment that happens and the bacteria enters the body, all those symptoms can evolve. Now, we shall talk about another very, very important aspect about anthrax, and that's prevention. If you've not had it, make sure you don't get it. What can you do? These are the things. One of them is that do not butcher an animal that has died of anthrax. Okay? Actually, we don't butcher any animals that have died of any other causes. So don't butcher any animal that has died of anything that you are not sure of. And also avoid as much as possible to get into contact with animals that have been infected with the anthrax, or even the products that are from these animals. Try as much as possible to avoid them. Which products are you talking about? We're talking about the meat, okay? The hides, the blood, and the hair. Also, do not get into direct contact with dead animals and don't eat them at whatever cost. That way, you'll have prevented yourself from getting anthrax. So, when somebody gets anthrax, what can they do? The things to be done are quite many, but the most important is that you should be seen by a doctor, a professional doctor, okay? So you should go to a doctor, they should be able to take your history, you should tell them about all the exposures you've had, and then they will be able to make a diagnosis. Now, when the doctor makes a diagnosis, they will prescribe the appropriate treatment. And most of the times, the treatment will involve an antibiotic. However, we so much discourage people from self-treatment. Do not self-treat yourself because you will not know the most appropriate antibiotic for anthrax. You may not know any other thing that might need attention. So, the moment you get anthrax or you suspect that you're having anthrax, please be seen by a doctor who will make a prescription of the right treatment and adhere to the treatment. Also, on top of the antibiotics, doctors might consider giving you an anthrax antitoxin. As we said earlier on, that one of the biggest challenges with anthrax is that there is production of a toxin, which toxin causes a lot of harm. So an antitoxin is usually very, very important, and the doctors might consider giving you antitoxins. Sometimes patients can really be seriously ill or severely ill that they need extra care. They might need blood pressure monitoring, they might need the oxygen levels to be measured, they might need a bit more aggressive treatment. So the doctors will be able to ascertain and assess and see the severity of the illness and they'll be able to treat appropriately. The key point here is that the moment you suspect that you're having anthrax, please be seen by a professional doctor who will make the necessary prescription so that you'll be well. And another important fact that we have to talk about is how do we protect our animals during outbreaks. Now, the most important thing, first of all, is to vaccinate. Okay, animals can be vaccinated just like we humans are always vaccinated. So vaccinate all animals, especially those that have not had any contact with the cases of anthrax. Let them be vaccinated. That will give them a lifelong protection against anthrax. On top of that, let all sick animals be, first of all, identified and treated. Okay, they should be given antibiotics that should be prescribed by professional veterinary doctors, and these antibiotics should follow the vaccination. Okay, so first of all, vaccination, and secondly, antibiotics that are prescribed by the veterinary doctors. Also, it's important to quarantine these animals, separate the sick ones from the healthy ones, and also avoid moving animals. I understand that it's a festive season, people might need to move animals, but all the places where anthrax cases have been reported, there should be a limitation on the movement of animals. That way, we shall be able to prevent anthrax from spreading from one farm to another. So one of the other questions that I've been encountering, or the questions that people have been sending in, is that what should be done to animals that are found dead? Now, if an animal has been found dead, it should be buried. Okay, that animal should be buried, and it should be like 6 feet under the ground so that the spores that are formed still remain in the ground. So bury any carcasses of animals that die suddenly, and it should be at least 6 feet under the ground. Also, it's important to note that the burial should be supervised by a trained veterinary doctor. Let not everybody just come and give in the advice. No, let there be a vet who gives advice on how the burial should be done. And also, all dead animals should not be slaughtered. The moment an animal dies of something that you're not sure of, don't bother to slaughter it. Count it gone and get it buried. And make sure that where you bury it, it's far away from the water source, because if it's near the water source, the spores can easily come from the animal's body into the water source, and they can contaminate the water, and the whole village will get anthrax. So bury the dead bodies of the animals far away from the water sources. How do we handle a sick or exposed animal? As earlier on highlighted, let's report all sick animals or dead animals to the relevant authorities. This can be the chairman, the health inspector, or the veterinary officer of your area. So report any sick animals or animals that die suddenly to the authorities so that they can take the necessary precautions. Also, we need to separate the sick animals from the live ones so they don't spread the disease to the live ones. And as well, let's ensure that we treat appropriately and promptly all the animals that have been identified as sick of anthrax. And what should you do to avoid getting infected with anthrax? First and foremost, any animals that have died of anthrax, do not touch them, do not skin them, do not eat them, don't eat their meat. And always wash your hands after handling animals or animal products. Wash your hands with soap or sanitizer. That will help kill off some of the bacteria, and also it will help you remove the spores that can actually cause disease. Also, report any suspicious cases of anthrax or any cases of animals that die suddenly. They should be reported to the veterinary officers and local authorities so that they take the appropriate caution. And if a person feels sick after handling animal products, let these people seek medical attention. Let them be attended to by doctors who will determine the extent of the disease and handle them appropriately. And if someone in your family seems to be suspicious of having anthrax, please let them be seen by doctors, take them to the nearest health centers so that they get the immediate medical attention and avoid the dire consequences of anthrax. Now, some people are asking me, so doctor, what happens to those of us who drink milk? Basically, there should not be any problem with milk. However, let the milk always be boiled. Unboiled milk should never be taken at whatever the situation, okay? Even without the anthrax, let nobody ever take unboiled milk. So milk can always be consumed, but we need to ensure that the milk is boiled and it's safe for drinking. That way we shall prevent anthrax. So as we conclude this long video, we need to look at the key messages that will help us to avoid this deadly disease of anthrax. First and foremost, anthrax is a serious infectious disease, as I already told you, caused by a bacteria called Bacillus anthracis that is found within the soil. Now, this disease mainly affects animals, but it also affects the humans, and it can cause death even without prior symptoms. How do we prevent it? Let's ensure that we report any sudden animal deaths to the relevant authorities, to the vets, to our local leaders, so that they take appropriate action. Let's not eat meat of animals that die suddenly. And also, whenever we deal with animal products, let's wash our hands very well with soap and an alcohol sanitizer where possible. We are not eating any meat from these animals. And it's also important to note that you cannot catch anthrax from another person the same way you can catch flu or fever, or cold. So let's take note of that. And also, let's keep safe. Do anything possible to ensure that you keep safe. And I wish you a good festive season. Thank you for watching. Bye bye.